Hello and welcome to Lessons My Patients Taught Me. This is Dr. Elliot Davidson, your host. I'm a family doctor and I do a little too much social media scrolling these days. There's a lot of discussions about doctors, medical care, and medical questions. There are numerous posts and interactions by and among doctors and other healthcare professionals. One recent post caught my eye. This gentleman looked to be in his mid-40s and he posted this: "I've never seen a doctor that impressed me. I can't wait for AI to take over." My first reaction was to feel sorry for this poor fellow, never having had a good doctor, but actually it is not clear that his expectations were appropriate. Many of his doctors could have been excellent. As my last guest mentioned, the attitude of many patients these days is apathetic, detached, or downright rude. The respect for authority has eroded, not just in medicine, but in many fields. Perhaps he could not recognize when his clinicians were good, or perhaps it was his own attitude that was undermining his experience. The vast number of patients are polite and appreciative, but things ain't what they used to be. Patients often miss appointments, use profanity, and sometimes they get physically violent. Patients also have lots of sources for medical information now, and they've had a hard time telling what is accurate. They don't want to rely on medical professionals. They don't trust us as much as they used to. I have to admit, I lament the state of affairs. There's plenty of blame to go around. I could point fingers all over the place, but some of it is also our fault. If we relied too much on the pharmaceutical companies, the big industries such as big dairy and big meat. Many times, industry that gained from these situations were the ones that were actually writing or contributing to national guidelines, like the food pyramid. It is still happening. As many of you know, I have been on a campaign to get doctors to listen better to their patients. Davidson's number one rule is listen to the patient, and they will often tell you the diagnosis. But patients have to do their part too. It cannot be a one-way street. Recently, I noticed a patient disrespecting one of my residents. While she was asking him questions, he was scrolling on his phone or looking around the room, practically ignoring the doctor. I advised her, if this happens, it's okay to call the patient out on his behavior. Now, back to the post about wanting to hurry up and get an AI doctor. Yes, AI is here and already helping. AI is a great listener, organizer, and can create an excellent differential diagnosis. AI can write near-perfect patient instructions, although it may misspell the name of the consultant or get the dose of a med wrong, so you always have to double-check. But for all you AI enthusiasts out there, and count me as one of them, here's a list of 10 things that AI can't do as well as your human being physician. I talk mostly about family docs, which is what I know best. Number 1, AI can't build deep trust and rapport. A human doctor reads emotion, responds with empathy, and earns trust over time. Even if you wrap an AI's hand in terry cloth, it would still feel like a warm USB cable. Touch is not just data, it's reassurance. Number 2, AI can't reliably pick up subtle nonverbal cues. The hesitation before answering, the joke that doesn't land, the body language that says, "This is not the chief complaint." Family physicians notice when something feels off long before it becomes measurable. Number 3, AI cannot make complex ethical judgment calls, such as end-of-life decisions, informed consent, and value-laden trade-offs require moral reasoning and compassion. When patients ask, "What would you do if this were your mother?" AI is likely to melt. Number 4, AI cannot adapt well in chaotic real-world clinical situations. Emergencies are messy, information is missing, often equipment fails, humans improvise. This matters in surgery and yes, even in minor procedures that we do in our office, when the universe has not read the protocol first. Number 5, AI cannot fully understand a patient's life context. Things like social stressors, family dynamics, culture, money, fear, pride. This is where medicine actually happens. This is primary care's superpower, not being a specialist in a specific disease, but a specialist in you. Number 6, AI cannot perform nuanced physical exams. Touch still matters, palpation, pain response, temperature, texture. These are subtle human sensory judgments. We may get there someday, but for now, humans remain the superior input device. Number 7, AI is unlikely to take true responsibility. Physicians carry legal, professional, and moral accountability, and that weight changes how decisions are made. Garbage in, garbage out. AI, when things go wrong, may simply throw its programmers under a Waymo bus. Number 8, AI cannot deliver bad news well. Things like timing, tone, silence, presence, these matter more than perfect wording. A long-standing therapeutic relationship doesn't eliminate pain, but it makes it much more survivable. Number 9, AI is not quite ready to mentor, teach, and inspire. Training clinicians requires role modeling, storytelling, judgment, and scars earned the hard way. Someday, the gray-beard AIs may teach the younger ones, but for now, humans still have the edge. Number 10, AI doesn't truly have a gut. Experience-based intuition, the I can't prove it yet, but something's wrong moment, comes from years of seeing people, not just patterns. It's not mystical, it's memory with consequences. Sure, AI is powerful, AI is fast, AI is useful, but family medicine lives in the space between evidence and humanity, where touch reassures, judgment matters, and responsibility is personal. That space is still ours. My poster, who was wishing for AI, better be careful what he wishes for. I do hope he finds some doctors he likes. It might start with him being a better patient. AI is definitely here to stay. It will make many things better, but I sure hope we don't lose the human touch. Otherwise, this guy and many others are going to be even more disappointed. This conversation is just starting. I am very interested in hearing what you think about this. What do you see as the advantages of AI, the downsides, the dangers, the slippery slope? Reach out to me on Facebook, Threads, TikTok, LinkedIn, Spotify, or Blue Sky. This has been Dr. Elliot Davidson, Family Doctor, for Lessons My Patients Taught Me. We have some exciting podcasts coming up. My next guest is a biotech CEO in Dublin, Ireland, so it's our first international podcast. Stay tuned and stay healthy and warm out there.
The preceding podcast contained discussions of medical cases where names and identifying details were altered to protect the privacy of individuals. The views and opinions expressed were those of the individual speakers and do not necessarily reflect the official policy or position of any affiliated institutions or organizations. This podcast was for entertainment purposes only and should not be taken as medical advice.